Hi, I'm Louisa, EMDR psychotherapist, and I'd like to explain a little about how EMDR, eye movement desensitization and reprocessing, works. EMDR is a therapy designed to help people recover from trauma and distressing life experiences. Unlike traditional talking therapies, it doesn't require you to go into detail about what happened or spend a lot of time analyzing it. Instead, it helps your brain process memories that may have become stuck. Here's a bit of the science. When something overwhelming happens, our brain sometimes struggles to file the memory away properly. It can get frozen in its raw emotional form. That's why people often experience flashbacks, nightmares, or strong emotional reactions, even long after the event. In EMDR, we use bilateral stimulation. This may be eye movements, tapping, or sounds that move from left to right. This activates both sides of the brain while you briefly bring the memory to mind. Doing this helps the brain reprocess the memory and move it into long-term storage where it no longer feels so raw or overwhelming. Over time, people notice that the memory loses its intensity. They can still remember what happened to them, but it no longer carries the same emotional charge. This allows often to feel more calmer, safer, and more in control. What makes EMDR different from traditional talking therapy is that the change happens through the reprocessing mechanism rather than mainly through talking things through. It's often described a faster route to healing, especially for trauma, because it works differently with how the brain scores and processes the memories. So, if you'd like to learn more about whether EMDR would work for you, feel free to get in touch. It could be a powerful way of finding relief and moving forward after a difficult life experience.